like to start the AIOC session, How I Made a Difference in Ophthalmology. And I would like to invite our first speaker, Dr. Diva Misra, sir, to speak on pivotal survey of VR training status. Yes.
So very good morning. So sorry for the delay. So I'll be talking about the pivotal survey which we did a few years back, which is the Pan India Vitro-Retina Fellowship Survey. Dr. Apurva, Dr. Nilesh and Dr. Avnish helped us with this survey. So India has a lot of very nice institutes that offer subspecialty training, especially in retina. When we conducted the survey, we found that almost 40 institutes were actively and regularly following up this course. So we conducted a survey. The purpose was to evaluate the surgical volume, training, and the experience of VR surgery fellows in India. Now we had a Google form which had around 80 questions, and we created a list of fellows across India and mailed them their fellowship directors, and we tried to mail them individually also this form. Now coming to the results, we got response from around 138 fellows. Now the majority of them, 64%, were female, the fellows at that time. The first question that we asked them, that why retina surgery was the choice for them, and majority of them chose it because they were very passionate about it. Considering the choice of institute, why they opted for a particular institute or why that was the number one choice, the number one point was the number of volume of cases that the institute provided them with. Coming to the working conditions, most of the fellows worked for more than 10 hours, and majority of them had to work at times on a Sunday. Most of them, around 60%, had 10 to 15 leaves, and the majority of them had a stipend of somewhere between 20,000 to 30,000. Now, almost 34% found the fellowship experience quite stressful, and the number one reason for that was that they got less time to spend with their family. Coming to the exposure per se, the assisted cases, if we talk about surgical cases, around 41% got 100 to 500 cases to assist, but they performed only, around majority of them performed less than 10 less than 10 cases in the whole fellowship duration. Then we talked about the different surgical things in there, the experience when it comes to that. Most of them did an okay number of buckles, but the other surgeries were quite less. Medical retina exposure was quite good. They got adequate number of lasers and intravitreal injections. Coming to the academics, most of them had around one session a week, and they could not find enough time to do some research. The number of manuscripts submitted was between 1 to 3 for majority of the fellows, and almost 60% could not publish any manuscripts during their fellowship time. Coming to conferences, they got to attend around 1 to 3 state or national conferences, and around 75% did not attend any international conference during the fellowship, and around some of them got the opportunity to present at these conferences. Now coming to the post-fellowship plans, it was good to see that almost 70% wanted to go into exclusive VR practice, and most of them, when we talked about the job or the employment they were looking for, the number one reason for point was the facilities, the infrastructure that was there at the hospital that they wanted to work at. Most of them wanted an institutional setup to begin with, rather than a government or a solo practice or an individual practice. Now we also asked them what they wanted in the fellowship program. Majority of them wanted a mixed kind of an entrance exam with an interview and a written exam as well. And the ideal duration they thought was around 2 years. And the ideal stipend was the last option, that is more than 45,000. So if we have put more options, I think that would have been the ideal. So we asked about whether they wanted a common exit exam. Majority thought it was not a good idea. And whether they wanted a central fellowship governing body kind of a thing. So majority of them thought that will be a good idea. So we also looked into the literature, and similar studies had been conducted by our American counterparts and American and European counterparts, and they fared a bit better than us. The average number of vitrectomies that they had done in a 2-year period was more than 400, which was way more than what an average fellow does in our country, and they had published on an average of over 4 papers. Similarly, in another study from the United States as well, we found that the number of surgeries done was definitely more than what we do, right? So coming to the end, there was a lot of disparity between all the institutes. Some institute gave a huge volume of surgeries, gave the fellows a good opportunity to publish and attend meetings, but there were most of the institute did not give this opportunity. Majority of them didn't have any good research opportunities. We could not find a uniform curriculum that was there amongst all these fellowships, and there was no surgical minimums. Like a lot of people had done 0 cases as well, right? So working on these points, I think we can help the AIOS and other bodies to help form a better curriculum for our fellows, and we intend to do this service for other specialities as well in the future. Thank you.
Thank you so much, sir. So thank you so much. I think the most important thing over here is that if you look at the academic exposure in terms of attending conferences as well as publishing papers, there's almost 60% who have only attended 1 to 3 conferences or have published 1 to 3 papers. So one thing
most of them didn't publish anything.
Most of them didn't publish anything.
Yeah.
And when you mentioned that the primary criteria was surgical opportunities when they're looking for the fellowship. So retrospectively, considering your VR fellowship, do you feel that high volume cases help, or would you rather suggest people who are listening to go for a more structured approach, lesser cases, but a more guided approach that is usually followed in the United States?
Right. So when I was in my fellowship, definitely the number one thing on my mind was to get more cases. But in retrospect, I realized that it's more important to do individual steps, especially in VR surgery. There are 5 to 7 basic steps. If you have done all those steps, maybe not in the same case, but still you can stitch things together at the end of the fellowship. For example, when I finished my fellowship and I joined a VR practice, the first case that was kept for me was an optic disc pit case, right? And of course, I'd never done that case, but I'd done vitrectomy, I'd done ILM peeling, I'd done gas injection, right? So I could able to do that. So because all those individual steps I could do them repeatedly, right? So it's not important. A lot of people think that I've not been able to done even a single complete case,
exactly,
right?
Exactly.
So I don't think so. That is important. Volume is important. The more you get, it's better, but not at the compromise of other things, right? A lot of people leave everything else and keep running after surgeries. It's important, especially in VR. It's more important to do the steps, and if possible, if the numbers are good, that's okay. But not to worry if you don't get huge numbers, right? But in our American counterparts, they get a very large amount of numbers because
they're not allowed to progress before they complete certain criteria. They have a competency-based program.
Not exactly, because I was there for some time in the Stanford.
Yes.
So there, a person who had joined 6 months back, he had already done 300 cases.
Okay.
Yeah. So within the first 1 to 2 weeks, he was able to do quite a bit of vitrectomy.
Okay.
Yeah.
And maybe the people who didn't respond were the ones who were actually a lot busier with
That's actually a good observation.
So what we saw is that institute like RP Center, PJI, and other, maybe Arvind and other institutes, some institutes got a huge volume of cases, but majority of them, so there was a big disparity. Some were offering a very good program, but most of them were offering not a very structured program.
Right.
Yeah, why don't you all have short-term retina training courses, paid ones that are available like for cataract surgery? Why is there disparity that cataract can be taught for 1-2 months, but retina cannot be taught for 1-2 months?
Because, right, what we had in our institute short-term retina training programs also, especially from the people who come from the government, government doctors who come in for a training for 2 to 3 months. We tried to teach them, but there's a learning curve. Even you, for a good indirect ophthalmoscopy, you need at least 2 to 3 months. Somebody who's not, who's not done that enough. So even to get your diagnostic and clinical skills up to that mark takes time. Lot of our colleagues who are doing fellowship right now or juniors, some of them who had not done indirect ophthalmoscopy well in their residency, it has been 6 months and they are not very confident even with their barrage lasers and all that. So I think it has a learning curve. It takes time. That's why probably, yeah. And most of us don't get a good training or good exposure to retina in their residency. Cataract, most of us get it somewhat.
No, no. For example, I am a anterior segment surgeon. I want to also do retina, not the whole thing, but I want to be able to learn little bit of retina. So if I do a 2-3 month course to do that, but if a retina doctor doesn't know A to Z about cataract, also he can do a 2 month course and learn cataract by paying money. Why this discrepancy is there? I am confident that if I do a 2 month course, I will be good in doing. I will at least be okay in doing retina, but
No, the
no,
reason
no, no.
is
But
the
do you
reason-
mean?
Exposure for cataract.
Yeah.
No, residency, exactly.
And then not all of us are exposed to retina during our residency, right? We don't get to do or assist retinal surgery during.
True.
But you have short-term courses for intravitreal injections and all that. I think
Medical retina is there. For 3 months, medical retina courses are there. Some places I think do offer short-term, the kind of cases that you are talking about. Some people do offer it.
Also, when you start off with a surgical fellowship to get oriented with a biome and
Yeah,
the
that
entire
takes time.
setup and the inversion, I think that only takes 2 months. So by the time you start putting the cutter in full, your 2 months are done.
Yeah.
The other thing is that most of the cataract cases will be more or less same. There is nothing unique in that. But every retina case is a different.
Is a different case,
So
exactly.
that needs a lot of experience and.
And another thing is that if you land up in a complication in a VR surgery, then probably it will be difficult for even a VR surgeon to handle that. Yeah.
Right. Thank you so much, sir.
And at
So-
AIOC and especially our young leaders, we should, do more of these surveys, plan out and.
I think so
Yeah.
as well.